Hi everyone, I am Dr. Bharat Vijay Purohit. I am Director and Head of the Department Cardiology, Senior Consultant in Care Hospital, High Tech City. I will be talking about what are the risk factors of a patient who gets a heart attack and what should we do in an emergency. Now, a heart attack happens when there is a blood clots on an existing narrowing in the blood vessel. Only narrowing of a blood vessel, which we call as a coronary artery disease, do not cause heart attack. A person may be having a narrowing from years. He may have done an angiography 3 years back, 2 years back, and they might have detected there may be 50%, 70% blockages, but that they do not cause heart attack. What leads to heart attack development is on top of this narrowing, if the blood clots. So this clotted blood prevents the free flow of blood to the heart muscles, and that part of the heart muscle does not get any blood supply and it starts becoming dead. So this produces some symptom. Whenever the blood supply stops, it gives rise to some signals, and the signal will be in the form of what the patient experiences and what we get in the investigation. The patient experiences heart attack in the form of a chest pain. Now the chest pain can be in the center of the heart, or it may go to the left side, or it may go to the right side, or it may go to the jaw area, or it may go to the little bit of the stomach area. So it is not necessary that everybody will get chest pain. Every individual has a different way of perceiving these discomforts. Some people get pain, some people might get sudden squeezing sensation, some people will feel there is a heavy weight has been put on the chest area, some people may feel little burning sensation. There are people who have complained of vomiting sensation and they go to the gastroenterologist by mistake and then they come to us. So these are the various symptoms. Some people suddenly start sweating profusely and they start feeling giddy because of the low blood pressure which happens due to the heart attack. So when somebody gets this sudden symptom which he had not experienced in the past and causes so much of discomfort, that is what we call as a heart attack. Now if somebody is experiencing heart attack symptom, we should not panic. The first and foremost thing is we should reassure the patient and give him complete rest, and he should not be walking, or he should not be climbing stair, or he should not be running. And from there immediately with full rest, the patient needs to be taken to the nearest hospital. There is no need to do any self-medication. There are a lot of people who say you take sorbitrate and this and that. No. In a heart attack, sorbitrate doesn't work. Rather, it can give rise to more serious complication because sorbitrate has a tendency to lower the blood pressure also. Sorbitrate is a drug which to be given below the tongue only if somebody experiences angina. Angina means because of narrowing, when you do some activity, when you walk little distance, when you climb stairs, you feel some chest tightness. That is called angina, and that can be relieved by taking a sorbitrate. But if you have already got a heart attack, then sorbitrate is not going to help you, rather it may cause harm. So do not do any self-medication, go to the nearest hospital, and in the hospital the investigations are done. The first and foremost investigation is an ECG which may show some symptom. There are situations where the first ECG may not show any sign. 25% of people can have a normal ECG on the first time. So the doctor may ask you to wait for some more time, then after 1 hour or 2 hours he may repeat the ECG, and in the meantime he will do some blood test also. These blood tests are marker of myocardial damage, the muscle damage which liberates into the blood, and the blood when we do testing we find them. So these are indirect markers of heart damage which happens due to heart attack, like troponin or CKMB. So if your troponin is elevated, you have a classical symptom, then it suggests that probably you are having a heart attack. And then they do a 2D echo scanning which tells us which area of the heart is getting affected, and then they can do an angiography. Now these are the investigation which tells us whether you are having a heart attack or not. These are the basic investigation, and once they diagnose that it's a heart attack, the first thing which has to be done is to prevent the blood clot from forming further. So for that we give blood thinner in the form of aspirin and other blood thinners. So 2 blood thinner will be given, either aspirin or ticagrelor or prasugrel. Based on the hospital and the doctor preferences, you can be given any these 2, aspirin plus one of the 2. And then the treatment is to remove the blood clot. The blood clot can be removed either by giving a clot dissolving medicine which is called a thrombolytic, or if you are in a hospital where an angioplasty can be done, they will immediately take you to the cath lab where they will do an angiography, find out which of the blood supply is developed a blood clot, and then they will pass a balloon and blast it so the blood clot gets dissolved or the blood clot is broken into pieces, and then may put a stent to open up the narrowing. So this is the best treatment, and one thing which I will tell you here is do not panic, and every second is important in a heart attack, because as long as the blood circulation is completely blocked, every second your heart muscle is dying. So do not have that habit of jumping from one hospital to another hospital and all this thing. If you have any doubt, talk to your physician on phone. If you want, you can send the ECG and all the reports to your concerned doctor, and you can make the doctor discuss with the doctor in the hospital and then take a treatment as early as possible. If you have reached a hospital where angioplasty cannot be done, take the blood dissolving medicine. If you have reached a hospital where they can do an angioplasty, go ahead with the angioplasty, because success of angioplasty is more than 90%, whereas the success of clot dissolving medicine is only 50 to 60%, whereas it can have more complication. So this is all about the emergency treatment in a heart attack, and how do you diagnose it, and what you should be doing when somebody has a heart attack. The most common treatment given in patients who have got blockages, that is angioplasty and a bypass surgery. Being a cardiologist, I will be focusing more on angioplasty. Just to make you understand what all these terminologies are, angiography is a test, angioplasty is a treatment. So stenting is the implantation of device during that angioplasty procedure. So that is what is called a stent. So I hope you are clear. Angiography or an angiogram is a test. After the test, when we find there are blockages, we suggest the patient to go ahead with an angioplasty, in which these blockages are cleared and we put a stent. The process of putting the stent is called a stenting, and the technology by which we are doing this is called an angioplasty. So this is all about the three technology. And when should we do all this thing? If you have any symptom or by any investigation you have been identified that probably you are having a blockages, either by a treadmill test or by a stress test or by a CT scan, you can be, or maybe because of your symptom, if the doctor has suggested you, then we subject the patient to go for a test called angiography. In angiography, what we do is we insert a small tube through your hand or through the leg. Don't get worried. There are a lot of people who get worried that something is getting inserted inside the body and it may cause harm. Be assured and rest assured, these devices which are designed to go inside have been tested and they are absolutely safe. So they don't cause any trouble when they are going inside, and the reason why we are putting them inside is the dye which we are going to give, which will tell us about the blockages. If we are very close to the heart, then we can give very limited amount of dye, and with that we can identify the entire blockages in all the part of the. If we give the same dye in the vein in the hand, then we need to give a lot of dye, because everything will be diluted in the whole body. So these pipes which are designed to go inside, and the wires, everything, they are made of very safe material. They don't cause any symptom. And if you ask me what is the risk factor which is there in doing the procedure, if it is getting done by an expert, then I hardly see anybody getting a complication because of an angiography. The risk factor may be less than 0.1%. Now, once you have done an angiography, then you find out there are multiple blockages. And in these blockages, if you have got multiple blockages, then the option will come whether you have to go for a bypass surgery or you have to go for an angioplasty. What are this technology? If I explain you in a common terminology, suppose you want to go and reach your home and there is a traffic jam. How do you reach your home? Either you take an alternate route and reach your home. That means you are bypassing the blockages. Or you clear the blockage and go straight to your home. So the process of clearing the blockages with the help of a balloon and then putting a stent so that it doesn't reblock is called an angioplasty and stenting. And the process by which we create an artificial route bypassing these blockages, that means we are connecting one part of the artery, the beginning part, and connecting it to the distal part, and so that this blood bypasses this and goes through this alternate channel is called a bypass surgery. So depending on your blockages, type of blockages, nature of blockages, number of blockages, and the risk factor which you have, the risk factor to decide what is the risk of an angioplasty, what is the risk of a bypass surgery. Because remember one thing, we are not treating the angiogram. You may have multiple blockages, but your doctor may still suggest you to go for an angioplasty, because if the human being is very high risk for surgery, he is a 90-year-old, he is having multiple lung problem, he has got a kidney problem, he is very frail, then surgery cannot be done. So in this situation, the number of blockages only do not decide the treatment procedure. You have to look at wholesome. You have to correlate the patient condition with the blockages and then take a call what needs to be done. And that is where the difference of opinion comes. If every doctor tries to correlate all this thing and tries to give the best what he feels is the right for the patient. So when you take multiple opinion, you may find that one doctor is suggesting angioplasty, one is suggesting bypass, another is suggesting medicine, and it all happens because how you are correlating all the various information with you, because there is no perfect way of doing it. Human beings are totally different. One thing which works on one may not work on others. You are not machines where everything will be exactly perfect, and human beings are not mathematics that 2 plus 2 is 4. So you need to correlate multiple variables including your own experience and then suggest the patient what is the best treatment. Now coming to the stents, we have various stents available. The stents are made of metal, and nowadays we have stents which are made of dissolvable material. So in which you implant the stent and after 2 or 3 years the stent disappears from the body. And these metallic stents, they are coated with a medicine. Earlier generation we used to have stent made of metal, but the problem with this earlier generation stent was when we were putting a stent, after a period of say 6 months or 1 year or 1.5 years, we used to see the patient developing reblockage. A very commonly asked question to us is, what is the life of this stent? To make you very clear, these stents, or what is the guarantee or what is the warranty? To understand it, there is nothing called guarantee or warranty in human beings. What we have seen, the technology is not 100% developed so that you get a 100% result in all the patient. When you implant a stent in 100 people, out of 100, 10% of people can develop reblockages, and generally these reblockages are seen to happen within 6 months to 1 to 1.5 years. If it is not happening within this period, generally these stents will not develop reblockage in the future. So this process of reblockage, or what we call as a failure of stent, is happening in most difficult scenario is 10%. 90% of time when you put a stent, it remains all right throughout the life of the patient. So that is about the various stents. You have a metallic stent, we have a bare metal stent, you have a medicated stent, and then you have something called dissolvable stent. So these are the 3 categories of stent which are available, and talk to your doctor, and whatever is the best you can go ahead with it. And if your blockages are such where stenting is difficult, or you have a scenario where you have multiple issues where the doctor suggests a bypass surgery, then you have 2 options. Either you can go with a minimal invasive bypass surgery or a conventional bypass surgery. But one thing I will tell you, if somebody has got a heart attack, then the role of bypass surgery, even if you have got multiple blockages, is very, very low. In a heart attack, which is an emergency, the best treatment is to go with an angioplasty. Bypass surgery, very, very extreme scenario, only a bypass surgery is suggested. Even if you have multiple blockages, still the doctor will suggest go ahead with the stenting and angioplasty. So this is something you need to keep in mind. Don't get confused in emergency that I have got 5 blockages and still my doctor is suggesting angioplasty. No. But in a normal scenario, if you have got multiple blockages, discuss with your doctor, whatever is the best treatment, go ahead with it and take it. Thank you.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.